Welcome to Empower Her Radio, the space for powerhouse women ready to step into their next level of abundance, purpose, and personal freedom. I'm Dr. Corey Winn, a high performance coach, doctor of physical therapy, philanthropist, and business consultant. I help ambitious women align with their highest calling, expand their wealth and impact, and create a life that feels as good as it looks. If you're a high achieving woman who's built success yet finds yourself craving more alignment, more purpose, more ease, you're in the right place. Here, we bridge the gap between ambition and fulfillment. Through transformative conversations and proven strategies, you'll gain the courage to step into the fullest expression of you. Build a powerhouse business that aligns with your expertise and divine gifts, and lead your life, both personally and professionally, with unshakable confidence, worthiness, and compassion. This is about expansion, legacy, and owning your power unapologetically. You already have everything inside of you to create a life of unlimited possibility. It's time to unlock it. Welcome to your next level. Let's dive in. This episode of Empower Her Radio with Dr. Corey Winn is brought to you by Her Quantum Rise, the private coaching experience for the woman who refuses to play small. Her Quantum Rise is where high-achieving women come to elevate their leadership, align with their deepest purpose, and unlock overflow in every area of life. This is where you shed the old paradigm, step into your highest identity, and rise with clarity, certainty, and unstoppable momentum. If you are ready to move from doing it all to leading from grounded power, if you feel the pull toward a bigger life, a bigger mission, and a bigger capacity to receive, then I would love to explore what this next level looks like for you. Book a complimentary call at www.corywin.com/free call and step into the room where your expansion becomes inevitable. Your rise starts here. All right, I am so excited. Today's guest is living proof of what's possible when women stop waiting for permission and start building healthcare and lives that actually work. I'm honored to welcome Dr. Jessica Edwards, a board-certified family medicine physician, health equity warrior, and founder and CEO of Zara Medical, a Black woman-owned, multi-state hybrid healthcare company that's reimagining what compassionate, accessible care looks like. She isn't just innovating healthcare, she's leading a movement for working moms, women of color, and high-achieving professionals who are done playing small. Welcome to the show, Dr. Edwards.
Thanks for having me.
So I want to hear kind of from the beginning. How did you get where you are? What made you think of starting Zara Medical? I want to know everything because it resonates, your message resonates with me so incredibly well.
Well, you know what's crazy is when I was growing up, I didn't actually want to be a doctor because I saw my dad working all the time, and I'm like, I don't want to do that. And then,
Yeah, exactly.
and I was like, Dad, like he was a pastor and also a doctor, so he named our church St. Luke's because Luke in the Bible is a doctor, and so he would preach on Sundays. Well, obviously, we have to be up extra early to be at church early. He
Oh
would
yeah.
come home and then eat and then go straight to clinic. And I'm like, this sucks. But the cool part was that he always came home with like treats and goodies. This was back in the 90s when, patients say, hey, I can't pay you right now, but I have a pecan pie. And
Right, exactly. Yes, and I
yeah.
will take that pecan pie gladly. Thank you.
Exactly. So, I saw that though. And so that was the one thing that always stood out to me with his relationships with his patients. So, when I sort of like made my own decision independently to go into medicine, I was like, I really want to take care of patients. I want to have sort of like that same aspect and relationship with my patients that he did. And I remember going to my pediatrician for the last time when I was 18, and I was devastated because he was like, listen, you are too big to be my patient. You need to find an adult doctor. And I just remember feeling like completely crushed. And I'm like, Dr. Sal's, I'm pre-med. Like, where am I going to go? I don't know where to go. Like, you've been my doctor my whole life. Like,
Right.
I was like, it
Don't
felt
push
like
me
a
out the
breakup.
door.
I know, it felt like a breakup. And so at that point, I was like, okay, I'm just going to do family medicine because my dad had been saying, like, it's kind of like the best of both worlds because you can always narrowed down, but you have the ability to be as generalized as you want. So I was like, all right, I'm going to do family medicine. I did residency in Jersey City, New Jersey. Once you make it in the New York area, you can make it anywhere. People say
Yes.
you're
Yes. My husband's from upstate. He says the
there
same
you
thing.
go. Once you can make it there, like you can make it anywhere. So did residency there, did fellowship at University of Rochester, and then decided to move back, worked for, a private practice for my first year, and then kind of decided like, hey, maybe I want to just, not see all of these like challenges with smaller practices and work for a larger institution. Looked at
Mhm.
the contracts and I was like, I don't like that either. And so I just, my husband has his business degree from Rutgers. And so he's like, you need to start your own thing. And I was like, I don't know if I want to do that. I was like, you're
Uh-huh.
your dad, working and da da da. So
Yeah.
anyway, I ended up getting the courage to start my own practice. And really I was kind of forced into doing it because when I told the practice I was working at the time, like, hey, I'm gonna go in a different direction. I really would like to, sort of figure out what my next steps are. All of my pregnant patients were dismissed from their practice. So I didn't have a choice. I was like, before it was like an option, and then now it was like, oh, we're doing this. Okay, we're
Yeah.
doing this. And so
Yeah.
I was not ashamed to start my practice in a My Salon Suites. And everybody was like, I can't believe you're doing this. Like, this is not where healthcare is practiced. And I remember a couple of my colleagues were like, you just don't need, and I'm like, no, my patients need care and they're here for me. So I'm not going to try to take out all these loans and do all this stuff for what appearance looks like and what people feel like I should be doing. Cause I'm like, think about it. I was like, you have a professional address. There's like, controlled access to the building. I have my own suite. They handle all the cleaning, all the maintenance and everything. And then all the hairstylists started sending people to me. A lot of them became my patients and it was
Yeah.
really great. And it was a great start. And I would say that was probably like the first lesson that I got in like just not giving a shit about what other people think because what they think really doesn't matter and it doesn't change anything, on the back end. And so practiced without fear most of my career and, worked for a couple of startups the last couple of years. And the last startup closed in like May of last year. And I started interviewing for other positions and they're like, yeah, we're going to need you like either in the office full time. And I'm like, this is a virtual role. And they're like, yeah, but we want everybody in the office. And I was like, I'm not doing that. I'm a mom. I got two kids, my son has autism.
Uh-huh.
I'm like, nope, I'm not doing that. And so I just started looking at, okay, let me get some more state licenses. Let me start doing telehealth. So Zara Medical was basically born out of wanting to create a beautiful health experience. Zara means beautiful in Arabic. And I felt like I was like, you know what? I'm going to create a virtual practice that I would want to go to as a patient. And then I started getting my MBA and things just took off from there.
Oh my gosh. And I just love how you started because the other side of healthcare in general, I don't care. I mean, I'm a physical therapist, but it doesn't matter where you are. People are afraid a lot of times
Yeah.
or have access or can't go, 30 miles outside of the city because that's where they live. And everybody gets their hair done. Everybody goes to a spa. Everybody, I mean, just, I can only imagine just the foot traffic and the patients who became your patients
Yes.
because you were there and accessible. I mean, just the accessibility piece warms my heart. My uncle, before he passed away, had a spinal cord injury. And I just think about how hard it was just for him to get to the doctor. You
Correct.
know, so the fact now that you're doing telehealth, tell us, I want people to know how much that's opened doors for you and for your patients.
It was so crazy. It took a really long time to get my California medical license, but once I got it, I remember the first patient I saw from California, I was like, okay, I was like, here we go, California. I got my, first patient from there, like California's a big state. And the first patient, she just got on the phone. She said, Dr. Evers, I'm tired. Because I always start off my visits, I just ask patients, I'm like, hey, Dr. Evers, especially for a new patient, hey, Dr. Evers, how can I help you? And I just kind of listen, that kind of gives me the context that I need to be able to say, okay, how do I support my patients? What do you need? And I'm not going to start off by talking, I just want to listen. And she's like, I'm tired. And I was like, okay. I was like, tell me, what's been going on. And so she walks me through this entire thing about how she moved from one part of California to another, wasn't able to find a primary care doctor who could see her in a fast amount of time, couldn't find an OBGYN who could see her in a fast amount of time. She went to the, excuse me, she went to urgent care, ER. trying to get a mammogram because she felt something abnormal in her breast. And everybody just kept, so sorry, pointing
Okay.
her in different directions. And so I was like, okay, I was like, let's get a mammogram order. I was like, we're going to find a place to send you to. It ended up being stage 2 breast cancer.
Oh my gosh. Oh my gosh.
And so had we said, you know what, we can't help you because you need in person, I was like, let's just get the order done. Let's send you to the imaging place. Let's get a report. And we were able to get that done for her within 2 days. We were able to get her referred to a breast surgeon who I was able to get on the phone with to call, discuss the findings, have my staff follow up, and get her into that person within 3 days. Now she's doing well. She's cancer free. And that was just really a testament to why accessibility matters. And
Yes.
when I started looking at going fully virtual, I said, you know what? Like, I don't know if it's enough. And I'm like, you know what? Let me just look up the research. And turns out that 95% of things that are handled in office can be handled virtually. Really, the major things are procedures, pap smears, and there are companies coming up with at-home pap smear kits now as we speak.
Oh my gosh. I can't imagine doing that myself, but that's, yeah, I could see that working.
Yeah. There are also companies that are coming up with the ability to do sleep studies at home. There are companies that are coming up with the option to do colon cancer screening at home. So we're moving toward technology in the society.
I'm glad that you said sleep studies, and I apologize for interrupting because I've often wondered, so you go to this foreign place with all these buzzing things and all these needs attached to you. And
Right.
I'm like, how accurate is this sleep study? Because I wouldn't be able to fall asleep in that environment.
Yeah, I find that oftentimes, just in my experience with ordering sleep studies, they get a lot of patients will either not sleep enough. They're only looking for specific things like apneic episodes. So they're looking to see does your oxygen drop. So they're able to kind of correlate things and still get the information that they need, even if, it's not completely accurate. But I find that, a lot of companies now, I remember my husband had a sleep study maybe like 10 years ago. And we tried, we followed the kid stuff and we still messed it up. And so I was like, there has to be a better way to like do this. And so now there are companies that are coming up with sleep studies. Everything's already connected. You just turn it on and you watch a video and get it done. Or they have like a respiratory therapist that'll call you and walk you through things, which I find, is incredible. And so, there's even AI software now where patients can take a picture of their throat and it'll estimate whether you actually, what the probability is that you have strep based on all of the research, all of the data. I mean, it's incredible. So the days of having to go into the doctor's office for everything is over.
Well, and you think about, just here in Colorado, I can do telehealth evaluations for wheelchair evaluations. And the amount of people who I see who live 3 to 4 hours away from me who could never get into the clinic because they have mobility issues already, hence why they
Right.
need a wheelchair or why they need, whatever piece of equipment. And there's this stigma, I think, of, well, you have to go to the office. And it's like, but why? I mean, I can only imagine the people who you see who don't even have a physician within 30 miles of their home
Right.
now have access to care. I mean, that just, oh my gosh, this makes me so excited.
It makes me excited too. And it lets me know that I was on the right track because I remember, some of my colleagues were like, oh, how do you do like fully telemedicine? Obviously, it was mostly specialists saying this, right? I'm
Right,
not,
right.
and so I always tell my patients, well, before Patrick Mahomes blew the Super Bowl, I'm a Kansas City Chiefs fan, but I literally, I was like, I'm your Patrick Mahomes. Like, I am here. I'm your quarterback. I'm here to make sure that you get to the right place. I'm the person who you like talk through things with if you have questions, concerns. And I'm here for you. And I was like, I cannot with the way that insurance reimbursement works, I can't have both. Right. So for instance, with like a direct primary care practice, they get those doctors get all their money up front. Is that enough for sustainability to address the physician shortage? Absolutely not. But it's good
Right,
for our lifestyle. So yes, obviously you can have in-person locations, you can have all this sort of stuff. What most patients don't know is that it takes 30 to 60 days to get reimbursed from insurance for your services. And I remember
right.
the other day I had a patient, I don't think she meant to make it snarky. She was like, saying it from a place of love, like she wasn't saying it mean, but the visit was very short because I, knew what was going on. I was able to, get the history in a good time. And she says, oh, look, you just made all that money that fast. And I was like, oh no, ma'am, it doesn't work that way. like, it's gonna take probably 30 to 60 days. I was like, let me look at your insurance company. It might be closer to 90.
Right,
And
right.
she was like, oh, I'm so sorry. I was like, it's cool. Like, it's not a problem. But there seems to be the stigma that doctors are making all this money when we're not really looking at the fact that insurance companies and hospitals are the ones that are making the most amount of money. And so I don't know how the conversation changed.
And I don't know from a family practice physician standpoint, but the amount of malpractice insurance you guys have to carry is astronomical, at least from what I remember reading years
Right.
and years ago.
Right.
So let's just put that out there too. You assume, like the general public assumes, that physicians make bank when you have to take into account student loans, malpractice insurance, the fact that you're licensed in however many states.
Right.
Yes, it's a lucrative career. It is. And let's put it into perspective that, you know, there's a lot of expense out there too.
Correct. Like people don't think about the cost of electronic health records. People don't think about the cost of running an efficient practice, right? So you have to pay for softwares that can use AI answering services. You have to pay for softwares that'll allow you to do virtual telehealth visits. You have to pay for softwares that allow for intercommunication between you and your staff. And also, trying to be convenient for patients actually costs. However, it is important to say that I think, is going to really kind of enhance and transform the patient experience, because instead of having to send a portal message and wait for somebody to get back to you, most practices will say 3 to 5 days, because before, with the other EHRs that I have, I'd walk in and it's like, you have 40 messages in your life.
Yeah.
Oh my God.
And these are not just like, I need a prescription refill. It's,
No, it is not. It's like
my
sometimes
whole
it's like a
my whole history.
dissertation, right? Sometimes it's a dissertation. So, being able to pick the right type of software to make it to where it's not overwhelming as a physician, I think, and to be able to assign tasks has been incredible for me. Utilizing AI has been incredible, and it still gives patients that touch to know, like, okay, I can get my needs addressed quickly, but it doesn't always have to be a human to do that.
Right. I love that you mentioned AI. A colleague of mine and I are putting on an AI masterclass in a few weeks for healthcare and business professionals, just to let them know what's out there.
Yeah.
I mean, the level of documentation that I know you deal with, that I deal with, that is HIPAA required and insurance required, and all these things, like it can make your life both professionally and personally so much more efficient, and you can spend more time with your family. So tell me how all of this beautiful telehealth has allowed you to create that atmosphere with your family that you wanted.
Yeah, I mean, I'm able to set my own hours. I'm able to, put blocks in my schedule. If, my son has an event at his school, I'm blocking it off. And those appointments are not available during that time. And I feel like also, as a female doctor, my patients seeing like sometimes my kids will just barge in during a visit. They're just barging in. My patients, instead of being like, oh my God, your kid is here, they're like, hey, JC, hey, Franklin, and it creates a humanistic side for patients to know, like, you know what? My doctor is actually a human outside of seeing me. Yes, they are this person that's going to help me with my health issues, but they're also human too. Yeah, they have a family, because I feel like the sterile environment of a clinic will make people forget that you're actually human too, that you actually have things outside of the clinic. And so I feel like telehealth is a really great, start there. And I believe in this so much that, we've created our own sort of like telehealth fellowship for young physicians that are coming out, within a couple of years of residency graduation. Obviously, we're applying for an NIH grant, but, things are a little shifty right now. So, a little
Yeah.
shifty. Well, so we've decided to pursue that on our own. And so our first fellow is starting in like June or July. But what we're going to do is we're going to say, hey, we're going to pay you, PGY4, like fellowship, pay. We're going to pay for you to get your MBA. We're going to teach you how to do telehealth. We're going to make you a junior medical director. And so when they finish this 15-month fellowship, they're going to be ready to fly, whether they decide to stay with us, whether they're ready to go somewhere else. And so our goal ultimately is to hopefully have about 10 fellows a year. We're going to start with one, obviously, and we, work our way up. But that was what a grant was going to give us opportunity to do. But I really think that there are so many opportunities to learn when you're first coming out how you can establish your value and learn early on, you know what? I'm a person too, and whatever. And once you set your values and you say, you know what, my family comes first, all of the decisions that subsequently follow will not interact or be, headbutting with your family because your decision is already going to be like, if I've got to be gone for 60 hours a week, I'm not doing it.
Right.
I
Right.
hang out with you late at night. I'm not doing it. My kids are laying right. You know what I mean? Like, so you're
Yeah.
able to kind of set those boundaries because I feel like as women, we're nurturers and oftentimes it's very easy to not set those boundaries. And then that is what leads to burnout.
Well, and I I just so love this conversation for so many reasons. But the fact that you started from the beginning and were like, I'm going to med school, but I am not doing it that way.
Right.
Have you seen, now that you've created this beautiful model, have your colleagues followed in your path? Have they, when I just remember personally when I branched out, my colleagues were like, "What are you doing?" And
Right.
there was like so much shade, and I thought, "Really?" And now it's like you see so many entrepreneurs pivoting and saying, "No, my family comes first," and it's working. So how are they on board now? Are they still like, "I don't know what she's doing?"
I think it depends, right? Because I feel like for doctors who have to be in the office because they're doing procedures or doing other stuff, it's very easy for them to look at primary care and say, well, how are you going to do a physical exam? How are you going to do this? Well, I mean, you get paid twice of what I get paid to do those physical exams. I'm here to coordinate care for my patient and make sure that they get the best care. And I think setting that objective has created that confidence where I'm throwing out stats, I'm throwing out data like, this is what the stats show about telemedicine for primary care versus in person. And creating that confidence in knowing the data and being able to spit that out, a lot of times the conversation and the shade stops.
Yeah.
I also, we're working on creating a master class for, physicians that are interested in seeing, where I can help them prevent to make the mistakes that they made before. I get a lot of people that send me questions and messages about like, hey, how did you do this? But, part of what I found is that if people don't pay for your advice, they're going to piecemeal things. They're going to ask you a bunch of questions. They're not going to listen to what you say. And so I
Mhm.
think there is value in having people invest in themselves.
Yes. Oh my gosh, yes. So incredibly huge because you do. As soon as you have to pay for something, you're like, "Oh, this is legit." Like, I'm going to pay attention because, you know, I, you know, I mean, all of us have had free courses or we've had free opportunities or whatever, and it's like,
Yep,
I'll go to that sometimes. But
correct.
with this model, have you found that you've been able to spend more time with patients than you typically would be
Absolutely.
able to?
I get to spend the entire 15-minute slot with them. Sometimes it runs over and I can send my patients a message via chat and say, hey, I'm running a little behind, be with you as soon as I can. I don't have to worry about the money part. My staff deals with that. So literally at their appointment time, I'm logging on, I'm talking to them. We have the whole 15 minutes. And my average is about 10, even though patients like full concerns are addressed, but the average in-person amount of time that someone spends with a primary care doctor is about 8 minutes. So
Oh
we're
yeah.
20% over that, already anyway, which is fantastic. But yeah, I get the entire 15 minutes with my patients. And I would find for the most part that is enough for patients that need, additional time. I'll say, hey, I've got another patient right now, but we can pick up our conversation a little bit later. I have a break here. Is that cool? They'll be like, yep. And I'll say, you don't have to pay another copay. And then I just bill insurance appropriately. So it's not as much of a rush because I'm not having to run back and forth in between rooms. I don't have MA saying, hey, can you sign this? Hey, can you do this? This patient is acting up out front because as a doctor, like when you're in the office,
They've been sitting out there for 2 hours.
right, like you're dealing with so many different, and it can kind of create like a chaotic, almost stressed environment that once you get a taste of seeing what it's like to not have to practice with chaos, you're like, bro, I'm never going back.
Oh yeah.
I'm never going back.
I mean, I say that to my husband all the time because he still works, the typical 9 to 5. And I get so much accomplished in a day doing so many different things that I'm like, the fact that he was going to be sitting in a 4 hour long leadership meeting today, I thought, no, 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 no.
Who is that? They say, ain't nobody got time for that.
Or the meeting for the meeting for the meeting that you were
Right,
like, that could have been an email.
quick, a whole email. It could have been a video.
So I know your big focus is women advocating for themselves. How have you been able to kind of niche down in that place? How are your feedback with your patients? I would love to hear about that because so many of us, like you said before, we're nurturers. So we put our needs aside. We're fine until we're not fine. So
Correct.
how are you yourself managing that as well as helping your patients?
Yeah, so I would say, I'm managing that from the perspective that like I said, when I see a patient, I just say, "Hey, I'm Dr. Evers, what's going on today?" And I just kind of let them talk. And the cool thing is that I would say for advocacy with patients, I feel like AI is leveling the playing field and making that better because now there are AI dictation softwares. I use one.
Yes.
So now I'm not sitting here typing the whole time, like, yep, I'm not doing that. I'm just sitting back having a conversation with them, just like I would be having a conversation with you now, and the AI puts all of the notes and documentation into the right section. So I literally am just kind of like reviewing after the visit is over, obviously doing action items during the visit. And I think probably in the next couple of years, there's going to be AI things for clinicians that are going to put in the prescription or start the prescription, start the lab order, and all that good stuff.
Right.
So the technology is definitely getting there. So I think one, being able to look at the care summary, making sure that you know they can see, okay, this is what we talked about today. I think that's a beautiful thing. It's really only
Mhm.
required by Medicare, but a lot of electronic health records have it. But being able to take that information in real time from AI, where as soon as I sign off the note, it sends to the patient. I think it's fantastic because it's customized to their visit, right? I think the other piece for advocating for themselves, and also, being an advocate for my patient is if they're like, yeah, this doctor has told me that I'm, just kind of being dramatic or, this and this and that. And that's not necessarily the case, right? And so,
Right.
I always tell patients I treat everybody exactly the same. So I'm not going to say, oh, you're young. Of course your hormones aren't. You don't know.
Right.
Oh, you're
Right.
fatigued, you're just tired, or you're overweight, or you need to do this, or you need to do that. No, like let's work it up. Let's see what's going on. And I always tell my patients, like, I've got like a 5% referral rate for things outside of like preventive screenings because I'm going to do everything I can. My dad used to tell me, he's like, your job as a primary care doctor, you're Inspector Gadget. He's like,
I
your
love
job is to
that.
kind of like work through it, find out what's going on. And honestly, when I was a resident, I used to hate this. I used to like, we would work like a 14-hour shift. We'd have to do morning reports. So we'd have to pick a case from that night. And people would just hurl questions at you. Did you ask this? Did you ask this? What was this? What? And you're just like, and so it starts off where you're uncomfortable, and then it develops those skills where you start asking all those questions. And
Right.
so now
Right.
my patients are like hurling stuff at me, and they're like, I'm so sorry. I'm like, no, just keep going. I was like, we got the AI, like, don't worry. That I think creates a lot of peace and calmness for patients where they don't have to feel like they have to try to rush everything. The fact that I have evening and weekend hours also helps patients to know they don't have to rush everything because if they forget, they're just like, okay, doc, I'm going to hop back on your schedule. They don't have to call anybody. They can just book their own visit. So I think that gets rid of a lot of the healthcare anxiety.
Right. Well, and just the aftercare summary in general, so many of us leave the doctor's office, even me, and go, "Oh, I forgot to ask that," or "What did she
Right.
say?" So it's just, like you said, the calming part of it. But I want to go back to the fact that you said, "Oh, just because you're young, your hormones can't be out of whack." I was 32 the first time I heard, "Oh, well, you're just getting older." And I thought, "What's older?" And
Correct.
what it took me years to figure out that my hormones were screwed up and to find the right physician to actually look.
Right.
The amount of people that I heard tell me, "Oh, you don't need all those tests, but I want them."
Right.
I understand that it's not typical, but I
Right.
want them. So
Right.
being able to talk with somebody like you who clearly knows the research, the things that need to be asked, the things that need to be looked at, I just so appreciate this conversation because I can tell you are so also an advocate for your patient and you're treating all of them exactly the same way, going, okay, well then let's look at this and let's look at this and let's look at this because you're right, we don't know. I
We
mean,
don't.
and from a PT standpoint, I don't get to write orders, I don't get to ask for tests, but to be able to have that knowledge of like, okay, this is a red flag, you need to call your doctor, or that doesn't sound right. Let's follow up with so and so. Um, I love that. And I love that you've opened this world. Do you feel like there are more women and minorities coming to see you on purpose because it's this very open, accessible environment?
Yeah, they are. And I have patients who I've never met in person, but they know my kids by name. I ask about their businesses. I ask about how things are going. I know, exactly like, I'm like, hey, we talked about this last time. And it's just over time, it starts to feel like I'm just their doctor who also happens to kind of be like a good friend of theirs too. And,
Everything that you've said makes me think of like the decades ago, like small town
and,
doctor
yep,
who knew everybody
yep,
and you saw at church or you saw in the grocery
right,
store. And that also puts so many people at ease
correct.
because you're accessible, you're available. The amount of times that I've been to the doctor and you can tell like when they walk in with the deer caught in the headlights look and you're like, you haven't had a chance to look at my chart. You don't have any idea why I'm here. And it's happened. I'm in healthcare too. Like I've walked into rooms and gone, "Oh, wait a
Mhm.
second. I don't remember why I was standing here." And but it to be on the patient side of that is very unnerving.
It
So,
is. It is.
oh my gosh, I love this.
Yeah.
So, I do want to go back though to your fellowship program. How are people finding out about it? Is there anything that I can help with as far as letting people know? I mean, obviously you're in the grant process, but I mean that is fascinating. And I would love to help you out. If there is any way for me to help, just get the word out. I would love to.
Yeah, so we actually have I can actually email you the link for our application because we're doing it like I'm not going through ACGME and that's, sort of they manage like residency programs and fellowships. And so you have a
Right.
choice to sort of do an accredited versus unaccredited fellowship. Our fellowship is going to be unaccredited because I'm not going through the hoops. I'm not
Right.
going through trying to prove anything. I've been practicing for, 11 years. I know what I'm doing. So we're going the unaccredited route with them, but that MBA says enough, right? Like
Oh
that,
yeah, absolutely.
the ability to like come up with protocols and be listened to and lead meetings. That is really what we're trying to do. So I can send you the link for that. But yeah, our goal is just to start empowering this next generation of doctors to know how to run a business, how to not get swindled by, the powers that be into saying like, oh, we have to do it this way. Well, why do we have to do it this way when the research shows this? Crickets.
Yes.
Right? And being able to know your value and push back.
I don't know if you found this, but when I was in the hospital setting during COVID, there had always been this pushback prior to COVID of, well, I want to work from home. I want a remote position. No, we don't do that. No, we don't do that. Then all of a sudden, everybody had to be remote. And I feel like it opened up this world of, oh, that can be done from home. Oh,
Correct.
and then, like you said, with the research, it shows that, in fact, it can be wonderful quality care happens, more time with your patients. So, do you feel like COVID kind of pushed that door open even more?
It barged it open. And I think one of the things that I found, particularly with looking at some of the feedback and why I've decided to not just end my day at 5 o'clock, typically, unless, some of my kids or whatever. But what I found is that, and the data shows that minorities were the least likely to be able to work from home during that time. And so for me, what it sort of created was the ability for me to say, you know what? How do we bring healthcare to people? And I love it that patients will do their visit with me on their lunch break. I work during like lunch hours
Yeah.
so that they can, get what they need done and they don't have to try to worry about it. And those are kind of like my busiest hours during lunch and after, after hours. So, for me, when patients can like get on in their element, in their environment, not have to pick between, oh, I've got to try to request off. Oh my gosh, I have to get a doctor's. I've got to do all this sort of stuff. They can just talk to me right where they are. And I think that is the beauty of telehealth. I will say that I think that for those that are not doing full service primary care and not discussing prevention because they say, oh, I can only do urgent care on telehealth. That's not true. That
Right.
is not
Yeah.
true. You can
Yeah.
discuss all that stuff. You can order colonoscopies, mammograms. If you have the right type of EHR that allows you to communicate with your patients without having to like fax and email separately and all this sort of stuff and do it through the portal, the more efficient you are, the more you can help patients. And that's what I found.
Well, and let's go back to you mentioned you got to try and call your doctor and a lot of times leave a message. You got to try and take time off. And if you're a mom and you have more than one kiddo, they've probably been sick and you've probably used more than half, if not all of your PTO. I mean, let's talk real talk. When Eliza Jane was 10 months old, there was a month where my husband and I were like, we're going to get fired. There was not a week that
I've been
she
through.
wasn't sick at least 2 days. And we worked for the same company. It was
Wow.
like, we're going to get fired. We're going to get fired. So let's put some real talk out there about what moms essentially, or especially, deal with just trying to get to the doctor. So
Yeah,
accessibility piece is so huge. To have been able to go to the doctor on my lunch break and just sit down and not actually have to leave, because you also have to think about, okay, what's the commute?
correct.
We're in the city. So what's the commute? How long is it going to take me to get there? Oh, I have to take the whole day. I
Correct.
mean, just the doors that have opened, and I hope our audience who's listening is recognizing the importance of telehealth and also willing to write their senators and congressmen
Correct.
like I did. Because, for Medicare and Medicaid, they stopped telehealth for
Did it.
a bit
Which
um,
I
at the end of March, and it was just like I just have 5 patients on my schedule who now I can't see, who
right.
need equipment. I mean, this is not something that is kind of taboo and, oh, it might affect something. No, it affected people immediately.
Mhm.
So I love that accessibility piece is just so huge. And the trust level that you have with minority patients, they're coming to see you because you're a real person and you're
Right.
open and you're trying to do everything that you can for them.
And I think, what's crazy is a majority of my patients are young white women between the ages of like 18 to like 40.
Okay.
Because they're like, you know what? I'm tired of not being listened to. I'm tired of like not, and a lot of my patients are professionals. A lot of them travel. A lot of them, I have a lot of blue collar workers. I have like my practice, and I have celebrities. Like I got like all, different people across the spectrum, but they all are united with one thing. And I always tell, whenever I was, doing some executive production work with this new show called Making a Brand with Brandon T. Jackson, which is sort of like a Shark Tank meets Wild 'N Out because he's an actor and also comedian.
Oh,
Uh,
that's awesome.
yeah, so I was doing kind of like some work with him, and he was like, "Hey, can you stay in LA one more day?" And I'm like, "If I don't get back to my patients, you're going to see a line of people at LA." This multicultural line of people, and you can say whatever you want to say with that. So forget like the whole discussion about like, people not getting along. You're going to see this whole multicultural line of people locked arm in arm, like, Dr. Evers, get your butt on this plane.
Yes. Well, and like you said, it levels the playing field because the thing that I hear too is we're all around the same age and
Great.
we're tired of being dismissed.
Great.
Period. We
Period.
want to go to a doctor who
Period.
listens because who knows your body better than you?
Great.
And you know when something's off. So being able to find that physician who's like, okay, tell me what's going on.
Yeah.
Silence.
And I feel like doing virtual visits actually decreases some of the anxiety that patients have because it's less of this like big buy-in that you have to do. Like, oh my God, I have to take off work. I've got to drive. I've got to sit. I've got to wait. I've got to fill out paperwork. Then I got to wait on a doctor to come in. I got to have, all of this sort of stuff. And, sometimes, doctor's office, I remember working it. They're like, okay, ma'am, so your social number is 123. Mrs. Jones, go ahead and come on back. We'll have you leave a urine sample so we can retest for that chlamydia. Okay. Like, oh my God, there's no privacy here, child. There's no privacy.
Oh,
So, I live in New York City. So, when I do in-person care, I have I use like this physician co-working space called Lena Health with that, which I think the physician co-working space model is incredible, right? So when I am in office, it's such a cool check-in system where patients can just type in their phone number. It'll send me a text, hey, your patient's here. I'll be able to go out, go get them, and then bring them back. It is just technology has really leveled the playing field. And so, my advice would be for any patient that is like, hey, I've had enough with the healthcare system. I'm happy to see you. If you need like a specialist. We'll take care of it. I'm licensed in 26 states. And, I think we just have to stop talking about it and be about it. And, I remember few, months ago when we first opened, I was begging for funding. I'm like meeting with all these different investors, like, yeah, it's this like human touch thing or whatever. And, this is your overhead. And with AI, I've been able to decrease a lot of my expenses so that I can just focus on providing high quality care, engaging with my patients, bringing them back. And then also we have text. Forget the chat bot. I'm talking text where a patient can be like, Dr. Rivers, I don't feel good. I feel like crap. My staff can tag me and I'll say, hey, add them to the schedule. We always have same day availability. And so I think, yeah, just being about it. And I think I always tell people, if you have an idea, like, don't be afraid to share it. Like, because sometimes doctors are just like so busy in their own, you know, world of like having to see patients and being in this hamster wheel, they don't even know their value. And so I think if you have a doctor that's amazing and you feel like, you would much rather see them do private practice, encourage them. I remember a patient told me that. She said, you should get your own thing. I remember she told me that, and then like everything worked out. And I remember she came into my practice. She's like, see, I told you. I said, yes, you did. Yep.
And it's sometimes we as women or as women professionals, I don't know, it's like sometimes we need that permission for somebody to kick us in the butt and say, hey, you have this expertise, go do your thing. And it's like, oh my gosh, yes, I do. I want to be super respectful of your time. Do you have a few more minutes or do you need to go? Okay. You're writing a book, yes?
I am. So it's called Taking Ground, and I actually have it pulled up here. And it's about how AI is going to transform the healthcare experience. And so we are about done writing it, so it should be coming out early summer. But I'm really excited to kind of share my journey, share some patient stories, and really not just try to talk about the negatives of the healthcare system, because I feel like that's what most books talk about. It talks about, how physicians have found their way to freedom, by taking cash only. I did a health policy fellowship, so I have my own thoughts about that, and that's why I haven't pursued that. And I just feel like it's time to be positive. I think it's time to like empower patients. I think it's time for patients to have an understanding about what FMLA is and understanding how to utilize short-term disability. Because I've had so many patients that have gotten on the phone. They're like, Dr. Edwards, I'm tired. Every time I want to go to the doctor, it is a pain in the butt. I've got to try to do this. And I'm like, you do know for your chronic conditions, you can get FMLA approval, may not be paid, but you have that time off from when you need to go to the doctor. They're like, what? I'm like, yeah. If you need to take a mental health break, there's short-term disability. That's what that's for. So you can have a doctor that can educate you on those things. It makes a huge difference.
Yes. Oh my gosh. Well, I want to make sure that everybody who needs to see you has access to you. So how do they find you? How do they connect with you? Tell us all this.
So they can actually go to my website, www.zaramedical.com. They can also look up, Dr. Jessica Edwards, Telehealth. They'll find my website. It pops up really fast. They can read about my philosophy, how I handle things at my practice, how we do imaging orders, how we send patients to labs by being virtual. We also have an at-home physical kit that's free of charge to all of our patients. So you don't have to come in to get your vitals done. You can do it right from the comfort of your own home. And version 2 is going to be where it actually sends the information to us, where it'll flag if there's a problem. So we're in the process of working on that now, but I'm licensed in 26 states. If I try to name them all, I will get it wrong. So it's on the location side of our website, but I'm kind of like in a U all across. So I have a lot of like West Coast, a lot of the Deep South, Midwest, and then also Northeast as well.
That's awesome. This has been so enlightening. I can't wait to hear about how your residency program and fellowship program just takes off and your book. And I just so appreciate your time for today.
Thank you for having me. I think we need to have more of these conversations.
Yes, we do. Oh my gosh. Thank you so much.
Of course, no problem.
As we close out today's episode, I want to leave you with this. Your next level is already within you. If you're feeling that pull for more clarity, more alignment, and more courage to step fully into who you're meant to be, this is your invitation to take the next step. Whether you're an entrepreneur ready to scale or a woman standing at the edge of something bigger, the path forward starts with trusting your desires, owning your worth, and leading with your inner knowing. This is exactly what I offer. private VIP coaching, and where I guide women inside the 10K Club and 50K Club through consulting with She Sells and Superhuman Selling to help you gain clarity, step into aligned action, and build a life and business that reflects your highest vision. If you're ready to explore what's next, let's have a conversation. Book a free call now at www.corywinn.com/free call. I can't wait to connect with you. Talk soon.